Hi everybody, this video of mine is about infectious mononucleosis, which is simply known as mono. There is another famous terminology for this disease, and that is kissing disease. The virus that causes mono is transmitted through saliva, so you can get it through kissing. That's why it is known as kissing disease. But you should remember that you can also be exposed through a cough or sneeze, or by sharing a glass or food utensils with someone who has mononucleosis. However, this is not as contagious as some infections such as the common cold. You are most likely to get mononucleosis with all the signs and symptoms if you are an adolescent or young adult. Young children usually have few symptoms and the infection often goes unrecognized. If you have mononucleosis, it is important to be careful of certain complications such as an enlarged spleen. Rest and adequate fluids are keys to recovery. Now let me tell you the symptoms. Signs and symptoms of mononucleosis may include fatigue, sore throat, perhaps misdiagnosed as streptococcal throat that does not get better after treatment with antibiotics, fever, swollen lymph nodes in your neck and armpits, swollen tonsils, headache, skin rash, soft swollen spleen. The virus has an incubation period of approximately 4 to 6 weeks, although in young children this period may be shorter. Signs and symptoms such as fever and sore throat usually lessen within a couple of weeks, but fatigue, enlarged lymph nodes, and a swollen spleen may last for a few weeks longer. If you have been experiencing the symptom which I told you, you may have a mononucleosis. If your symptoms don't get better on their own in a week or two, you should see your doctor. Now let me tell you the causes. The most common cause of infectious mononucleosis is the Epstein-Barr virus, but other viruses can also cause similar symptoms. Although the symptoms of mononucleosis are uncomfortable, the infection resolves on its own without long-term effects. Most adults have been exposed to the Epstein-Barr virus and have built up antibodies. Therefore, they are immune and won't get mononucleosis. Coming to the complications. Complication of mononucleosis can occasionally be serious. The first complication is which can be very serious is enlargement of the spleen. Mononucleosis may cause enlargement of the spleen. In extreme cases, your spleen may rupture, causing sharp, sudden pain in the left side of your upper abdomen. If such pain occurs, seek medical attention immediately. You may need surgery. Liver issues. Problems with your liver may also occur, such as hepatitis. You may experience mild liver inflammation, that is known as hepatitis, a jaundice, which is a yellowing of your skin and the whites of your eye that can occur in this condition. There are some less common complications. For example, anemia, a decrease in red blood cell and in hemoglobin, which is an iron-rich protein in red blood cells. This can happen. Another complication, which is less common, is thrombocytopenia. This is a low count of platelets, which are blood cells involved in clotting. Heart problems. An inflammation of the heart muscle, that is myocarditis, can also occur in this. Complication involving the nervous system such as meningitis, encephalitis, and Guillain-Barré syndrome can also occur. Swollen tonsils, which can block breathing. This is also another complication. The Epstein-Barr virus can cause much more serious illness in people who have impaired immune systems, such as people with HIV or AIDS, or people who are taking drugs to suppress immunity after an organ transplant. Coming to the prevention. Mononucleosis is spread through saliva. If you are infected, you can help prevent spreading the virus to others by not kissing them and by not sharing food, dishes, glasses, and utensils until several days after your fever has subsided, and even longer if possible. The Epstein-Barr virus may persist in your saliva for months after the infection. No vaccine exists to prevent mononucleosis. Coming to the diagnosis of infectious mononucleosis. When patients come to us, we may suspect mononucleosis based on your signs and symptoms, how long they are lasted, and a physical examination. Doctor will look for signs such as swollen lymph nodes, tonsils, liver, or spleen, and he or she can consider how these signs relate to the symptom you describe. There are some blood tests such as antibody tests. If there is a need for additional confirmation, a monospot test may be done to check your blood for antibodies to the Epstein-Barr virus. This screening test gives results within a day, but it may not detect the infection during the first week of the illness. A different antibody test requires a longer result time but can detect the disease even within the first week of symptoms. White blood cell count. Your doctor may use other blood tests to look for an elevated number of white blood cells, which are one type is lymphocytes, which are usually high, and also their shape may be abnormal. That is atypical lymphocytes. These are suggestive of infectious mononucleosis, but not confirmatory to the diagnosis. Coming to the treatment, there is no specific therapy available to treat infectious mononucleosis. Antibiotics do not work against viral infections such as mono. Treatment mainly involves taking care of yourself, such as getting enough rest, eating a healthy diet, and drinking plenty of fluids. You may take over-the-counter pain reliever to treat a fever or sore throat. Medications. If there is a possibility of secondary infection, then we may prescribe antibiotics. Occasionally, a streptococcal infection accompanies the sore throat of mononucleosis. You may also develop a sinus infection or an infection of your tonsils, which is known as tonsillitis. I have made a video on tonsillitis the day before. If so, you may need treatment with antibiotic for these accompanying bacterial infections. There is a risk of rash with some medication. Amoxicillin and other penicillin derivatives are not recommended for people with infectious mononucleosis. In fact, some people with mononucleosis who take one of these drugs may develop a rash. The rash does not necessarily mean that they are allergic to antibiotics. However, if needed, other antibiotics that are less likely to cause a rash are available to treat infection that may accompany mononucleosis. Coming to the lifestyle and home remedies. Besides getting plenty of rest, these steps can help relieve symptoms of mononucleosis, which I am going to tell you now. You should drink plenty of water and fruit juices. Fluids help relieve a fever and sore throat and prevent dehydration. Take an over-the-counter pain reliever. Use pain relievers such as acetaminophen, coming with the name of Tylenol, or ibuprofen as needed. These medications have no antiviral properties. Take them only to relieve pain or a fever. Use caution when giving aspirin to children or teenagers. Though aspirin is approved for use in children older than age 3, children and teenagers recovering from chickenpox or flu-like symptoms should never take aspirin. This is because aspirin has been linked to Reye syndrome, which is a rare but life-threatening condition in such children. Gargle with salt water. Do this several times a day to relieve a sore throat. Mix half teaspoon salt in 8 ounces of warm water. Most signs and symptoms of mononucleosis ease within a few weeks, but it may be 2 to 3 months before you feel completely normal. The more rest you get, the sooner you should recover. Returning to your usual schedule too soon can increase the risk of a relapse. To help you avoid the risk of rupturing your spleen, your doctor may suggest that you wait about 1 month before returning to vigorous activities such as heavy lifting, roughhousing, or contact sports. Rupture of the spleen results in severe bleeding and is a medical emergency. You should ask your doctor about when it is safe for you to resume your normal level of activity. Your doctor may recommend a gradual exercise program to help you rebuild your strength as you recover. I hope you like this video of mine. Till now, if you have not subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my videos provide some sort of benefit to you, even it's a little bit benefit, please like this video and share this video through social media such as Twitter and Facebook.